If you're over 60, listen closely, because there's a subtle, almost invisible risk lurking in a habit many of you embrace for better health. Imagine going to sleep tonight feeling completely fine, only to wake up in a world where your arm won't lift, your words come out jumbled, or your sense of balance has simply vanished. This isn't a dramatic movie scene. It's the chilling reality of a stroke, a life-altering event that can strike without warning or pain, sometimes triggered by something you genuinely believed was helping you. As a brain doctor, I've had to deliver this heartbreaking news to far too many older adults. The surprising culprit? Not the usual suspects like smoking, poor diet, or a sedentary lifestyle, but a daily ritual many turn to for vitality and well-being: certain vitamins. Yes, really, your vitamins could be a hidden danger. Millions of seniors dutifully take supplements every day, hoping to fortify their bones, boost their flagging energy, or keep their minds razor sharp. While many vitamins indeed offer genuine benefits, some, particularly in excessively high doses or consumed at the wrong time, can quietly and insidiously put your brain and overall health in grave danger. Today, we need to talk openly about 5 common vitamins that might be increasing your personal risk of stroke, internal brain bleeds, or dangerous blood pressure spikes, especially during those vulnerable early morning hours when your brain is most susceptible. If you currently take or have ever considered taking vitamin D, E, B6A, or niacin, what you're about to discover might just be the critical information that safeguards your future. Before we dive into these essential facts, I'd be curious to hear your thoughts. Have you ever paused to wonder if your vitamins could actually be doing more harm than good? If so, share a 1 in the comments below. If this entire concept is entirely new and intriguing to you, type 0. And if the health of your brain or the brain of someone you cherish truly matters to you, please take a moment to engage with this message. A quick like helps ensure this vital information reaches others, empowering our community to make informed decisions for sustained well-being. Let's begin with arguably the most astonishing and perhaps widely misunderstood nutrient on our list: vitamin D. What many people, especially older adults, don't fully grasp about this seemingly benign supplement could ironically transform a peaceful night's sleep into a perilous ordeal. For years, you've likely heard a steady chorus praising vitamin D for its crucial role in bone health, its positive impact on mood, and its undeniable contributions to a robust immune system. And in truth, all of these claims hold water provided consumption is kept within moderate, appropriate limits. However, there's a vital piece of information that almost always eludes the packaging labels and often goes unmentioned by general practitioners, especially for the senior demographic. An excessive intake of vitamin D, particularly when consumed late in the day, carries a silent yet significant risk of increasing your likelihood of suffering a stroke. This may sound incredibly shocking considering its widespread promotion, but as a medical professional, I have unfortunately witnessed this correlation firsthand in my own patients. Consider the unsettling case of Mr. Walter, a sharp and disciplined 74-year-old retired Navy veteran who epitomized meticulous health management. Every single morning, with unwavering precision, he would arrange his array of daily supplements, prominently featuring a 10,000 IU vitamin D capsule that he had purchased without a prescription, believing it to be a fortress for his bones. What Mr. Walter heartbreakingly failed to realize was that this seemingly innocent, unwavering daily habit was subtly but persistently nudging his body toward a silent and catastrophic event. One fateful morning, his wife discovered him disoriented and unable to articulate his thoughts clearly. His right arm lay lifeless at his side. He had suffered a stroke, an unheralded calamity that unfolded quietly during the night. Subsequent laboratory tests revealed alarmingly high calcium levels in his blood, accompanied by stiffened arteries and wildly fluctuating blood pressure, a cocktail for disaster. The undisputed culprit: vitamin D toxicity. When large doses of vitamin D are ingested, especially in the absence of precise medical guidance, it initiates an unwelcome cascade where calcium rapidly accumulates in your bloodstream. Your body, ill-equipped to process such an unnatural surplus of calcium, then attempts to shunt this excess into your arterial walls, causing them to gradually stiffen and narrow. This dangerous physiological response directly paves the way for the formation of blood clots, one of which can tragically embark on a perilous journey directly to your brain, precipitating a stroke. The natural aging process already diminishes the inherent flexibility of our arteries, and when compounded by factors like dehydration, compromised sleep patterns, and an ill-timed nighttime calcium spike, you are, in essence, creating a perfect storm within your cardiovascular system, culminating in a heightened stroke risk. The truly terrifying aspect of this phenomenon is its insidious nature. There are often no discernible warning signs. You simply go to bed feeling completely normal and awaken to a life forever irrevocably altered. Adding to this peril, many over-the-counter vitamin D supplements readily available across the United States contain concentrations far exceeding the actual physiological requirements for older adults. You'll often find dosages of 5,000 IU, 10,000 IU, or even higher, with many individuals assuming that more is unequivocally better. Yet numerous studies have conclusively demonstrated that even a daily intake of 2,000 IU might be excessive for individuals who are not clinically deficient. Let me be unequivocally clear. If you are currently taking vitamin D, especially in conjunction with calcium supplements or heart medications, it is absolutely paramount to have your blood levels regularly monitored by your physician. Furthermore, it is critical to always take this supplement in the morning, never before bedtime. Do you know the precise international units, IU, contained within your current vitamin D supplement? If you're taking vitamin D right now, let's initiate an essential discussion. And if this revelation has prompted you to reconsider your vitamin regimen, please indicate your appreciation with a like, helping others encounter this crucial message. If the silent threat of a stroke from vitamin D has caught you by surprise, prepare yourself, because the next vitamin on our radar, frequently taken for supposed heart health benefits, can lead to an even more devastating outcome in older adults: a brain bleed. We are talking about vitamin E. Often touted as a heart helper, vitamin E has long held a prominent place in the supplement routines of many individuals, particularly those over 60. Countless seniors faithfully incorporate vitamin E into their daily regimen, genuinely believing it will fortify their cardiovascular system, enhance circulation, and perhaps even sharpen their memory and improve skin vitality. However, here's the critical information that rarely, if ever, makes it onto the glossy product labels. Excessive vitamin E intake, especially when combined with commonly prescribed heart medications, can dramatically elevate your risk of experiencing a dangerous bleeding event directly within your brain. This holds true even if you conscientiously follow all other health guidelines. I want to share the unforgettable story of Mrs. Evelyn Brooks, an 81-year-old retired librarian from Ohio, a woman of sharp intellect, quick wit, and a perpetual book in hand. Mrs. Brooks managed a heart valve condition and was under strict medical supervision, taking warfarin, a frequently prescribed blood thinner. Her medical team diligently monitored her progress. Her blood work was consistently stable and her blood pressure remained well controlled. Yet one day, she decided to add an over-the-counter natural vitamin E supplement at a potent 800 IU per capsule, swayed by an advertisement she had seen in a magazine. "I thought it would help my memory and circulation," she recounted later. Just 3 weeks subsequent to introducing this new supplement, she was rushed to the emergency room in an acute state of distress, suffering from an excruciating headache, profound confusion, and relentless vomiting. Brain scans confirmed the dire diagnosis: a hemorrhagic stroke characterized by active bleeding within the delicate tissues of her brain. This catastrophe was not triggered by high blood pressure, nor by an accidental fall, but rather by the treacherous combination of her prescribed warfarin and the dangerously high-dose vitamin E, which collectively rendered her blood too thin to clot effectively. A single, fragile blood vessel within her brain succumbed to the pressure. Here's the critical understanding most people overlook. In substantial doses, vitamin E acts as a natural anticoagulant, essentially slowing down the body's crucial clotting process. If you are already taking antiplatelet medications such as aspirin or Plavix or any other form of blood thinner, and then introduce additional vitamin E into your system, your risk of internal bleeding quietly but significantly escalates. This is particularly perilous within the confines of the brain, where even a minute hemorrhage can irrevocably impair your speech, memory, or capacity for independent movement. Furthermore, consider this stark reality. The recommended daily intake of vitamin E for older adults is a mere 15 milligrams, equating to approximately 22 IU. Yet, a disheartening majority of vitamin E supplements readily available on store shelves boast colossal dosages of 200, 400, or even an alarming 1,000 IU per capsule. These products often come devoid of clear warnings or requirements for medical consultation, leading countless individuals to consume them daily for years on end, believing they are benefiting their health. Mrs. Evelyn Brooks survived her ordeal, but now requires the assistance of a cane for mobility, and her short-term memory, tragically, never fully recovered. Through tear-filled eyes, she confided, "I only wanted to help myself. I had no idea I was inflicting such harm." This is precisely the kind of devastating ignorance that breaks my heart, because Mrs. Brooks is far from an isolated case. So many seniors hold the sincere conviction that if something is classified as a vitamin, it must inherently be safe. But the unvarnished truth is that not all vitamins are universally safe, particularly when you are concurrently taking medications for heart conditions or blood pressure management. It is an absolute imperative to consult your physician before integrating any new supplement into your regimen. Now, if the unsettling prospect of a brain bleed hasn't sufficiently underscored the critical need for vigilance, allow me to introduce another widely used vitamin, often consumed for its purported benefits to nerve health and energy, that can insidiously damage your delicate neural pathways, sometimes permanently. Let's direct our attention to vitamin B6. You've likely encountered vitamin B6 in pharmacy aisles, often prominently labeled as a nerve support or brain booster supplement. Advertisements frequently claim its efficacy in enhancing energy levels, sharpening focus, or even improving memory. You might have even received informal advice suggesting its benefits for aging nerves. However, there's a crucial, often omitted warning that most seniors never receive. An excessive intake of vitamin B6 can, alarmingly, inflict damage upon your nerves, a condition that can regrettably become irreversible. Allow me to illustrate this with the experience of Mr. Harold Jenkins, a 76-year-old retired truck driver hailing from Kansas. He first visited my office presenting a constellation of concerning symptoms: a pervasive numbness in his feet, a persistent tingling sensation in his hands, and a noticeably compromised sense of balance. Initially, he dismissed these changes as simply the inevitable march of age. However, his situation escalated when he began to fall, first sporadically, then with increasing frequency. The third time, he suffered a severe impact, hitting his head on the bathroom floor. Upon meticulously reviewing his current supplement regimen, the underlying issue became glaringly apparent to me. For over a year, Mr. Jenkins had been consistently taking a nerve support formula. While the product label confidently declared its benefits for brain health and circulation, each individual tablet concealed a potent 100 milligram of vitamin B6. Moreover, he was taking 2 of these tablets daily, amounting to a staggering 200 milligram of B6 per day, an intake exceeding the recommended safe upper limit for seniors by more than tenfold. Here's the truly concerning aspect. Unlike some water-soluble vitamins that are efficiently excreted through urine, vitamin B6 accumulates steadily within your system over time. In older adults, this gradual buildup can severely compromise the delicate protective myelin sheath surrounding your nerves, effectively stripping away the insulation, much like exposed wiring. The devastating consequences manifest as persistent tingling, profound numbness, debilitating muscle weakness, involuntary tremors, and even unsettling cognitive impairments such as confusion or memory lapses. What makes this even more insidious is the gradual creeping onset of these symptoms. Many individuals mistakenly attribute these manifestations to arthritis, the unavoidable process of aging, or even the early stages of dementia, when in fact, the root cause could be B6 toxicity, a slow-developing, entirely preventable form of nerve damage orchestrated by a pill that was intended to promote health. if left undetected and unaddressed, this damage can indeed become permanent. Fortunately, Mr. Jenkins was among the lucky few. Upon discontinuing the supplement, the progression of damage halted, though he regrettably still relies on a cane for mobility and is no longer able to drive. He articulated his anguish to me, stating, "I only wanted to protect my brain. I never realized I was slowly poisoning it." Let us be unequivocally clear. Vitamin B6 is undeniably an essential nutrient, but it is required in exceedingly small quantities. Older adults typically need a modest 2 to 10 milligrams per day, an amount easily obtained from a balanced diet alone. Yet, numerous brain support supplements widely available online and in physical stores contain excessive doses of 50, 100, or even 200 milligrams. This is not merely superfluous, it is genuinely hazardous. Therefore, if you are currently taking any supplement marketed for nerve, brain, or energy support, it is absolutely vital to scrutinize the label, ascertain the precise dosages, and if you have taken such a supplement or know someone who has, consider how important this information is. You might be thinking, at least some vitamins, like vitamin A, must be inherently safe. It's simply for good eyesight, isn't it? Well, not entirely. Let's delve into the intricacies of vitamin A. If your experience mirrors that of most older adults, you have undoubtedly been educated on the indispensable role of vitamin A for maintaining optimal vision. Perhaps you've even intentionally supplemented with it to bolster your immune system, improve skin health, or due to general advice suggesting its benefits for graceful aging. However, here's a critical piece of information that almost nobody conveys, particularly if you are beyond the age of 60. An excessive accumulation of vitamin A doesn't merely lie dormant and innocuous within your physiological system. Instead, it systematically builds up over time, and this chronic accumulation can progressively elevate the pressure inside your skull. This increase in intracranial pressure can manifest symptoms strikingly similar to a stroke, inflict damage upon your vision, and even detrimentally affect the very architecture and function of your brain. Allow me to introduce you to the poignant narrative of Miss Dorothy Simmons, a 79-year-old retired piano teacher from Oregon. She possessed an ardent passion for music, diligently taught students from the comfort of her living room, and took immense pride in preserving her cherished independence. Then, insidiously, a series of alarming symptoms began to emerge. Recurrent headaches, followed by an increasingly blurred vision, which eventually progressed to debilitating dizziness and unmistakable slurred speech. Her distraught family, fearing the absolute worst, immediately suspected a stroke. However, when we conducted a comprehensive series of brain scans, a surprising and perplexing discovery emerged. There was no evidence of a clot, nor any signs of internal bleeding. Instead, Miss Dorothy exhibited a severe elevation in intracranial pressure, an overwhelming amount of pressure exerted within the brain's confines. Her spinal fluid was clearly backed up, placing tiny, delicate veins within her brain under immense stress. The culprit, shockingly, was vitamin A toxicity. For over 5 years, entirely unbeknownst to her, she had been taking a high-dose skin and eye supplement containing almost 10,000 IU of vitamin A every single day. Herein lies the pivotal difference. Vitamin A is fundamentally a fat-soluble vitamin. This crucial characteristic means that, unlike water-soluble vitamins such as C or B complex that are readily flushed out of the body, vitamin A is systematically stored in your liver, various tissues, and even within the complex neural networks of your brain. As we age, our liver's metabolic efficiency naturally diminishes, accelerating this dangerous accumulation process. When an excess of vitamin A saturates the body, it can precipitate a severe medical condition known as pseudotumor cerebri, aptly termed a false brain tumor. The debilitating symptoms mirror those of an actual tumor: relentless headaches, distorted or double vision, persistent dizziness, bouts of nausea, and, disturbingly, even permanent vision loss or discernible cognitive decline. The perplexing challenge is that many standard multivitamins already incorporate the full recommended daily allowance of vitamin A. Yet, individuals like Miss Dorothy unknowingly exacerbate this by layering on additional skin, eye, or anti-aging formulations, thereby inadvertently doubling or even tripling their intake. The generally recognized safe upper limit for seniors hovers around 2,500 to 3,000 IU per day, and even this should ideally be approached with medical supervision and only if demonstrably necessary. Nevertheless, a multitude of supplements sold online or in retail environments contain 5,000, 10,000 IU, or even substantially more. When taken consistently day after day for months or years, the escalating damage is chillingly easy to comprehend. Miss Dorothy is on a slow path to recovery, but she now necessitates regular eye examinations, meticulous pressure checks, and ongoing balance therapy. With a heavy heart, she shared, "I genuinely thought I was doing something beneficial for my body. I never once imagined it could inflict harm upon my brain. It is for precisely this reason that I share her powerful narrative. My intention is not to incite fear, but to equip you with verifiable facts, enabling you to proactively safeguard your health and cherished independence. If the risks associated with vision-focused vitamins gave you pause, then brace yourself for what transpires when a vitamin specifically marketed for cholesterol and heart health unexpectedly sends your blood pressure soaring to dangerous heights." Let's delve into the complex story of niacin, also known as vitamin B3, a supplement many of you may have taken or even been explicitly advised to take for the health of your heart. Niacin, commonly referred to as vitamin B3, has long been lauded and celebrated as a natural, non-pharmacological pathway to effectively lower elevated cholesterol levels. Indeed, some medical practitioners even prescribe it for this very purpose. You'll also frequently discover niacin incorporated into various heart health supplements, energy drinks, and a multitude of fortified breakfast cereals. However, there's a crucial aspect of the niacin conversation that is persistently overlooked or deliberately omitted, particularly when addressing the specific physiological needs of older adults. Niacin, when consumed in substantial high doses, possesses the alarming capacity to clandestinely induce severe and unpredictable fluctuations in your blood pressure, a perilous cascade that can ultimately culminate in the very stroke it purports to prevent. Allow me to introduce you to Mr. Frank Miller, an 82-year-old retired postman who made his home in Florida. He presented to me with an unusual and disconcerting amalgamation of symptoms: recurrent hot flashes that scorched his face, a pounding sensation that resonated within his chest, and episodic dizziness that would spontaneously appear and disappear each morning. His wife initially attributed these unsettling manifestations to anxiety, while his son conjectured that his existing blood pressure medications were to blame. Yet the genuine root cause remained an enigma, something no one had thought to investigate. Mr. Miller had been diligently taking an over-the-counter supplement, emblazoned with claims of being heart healthy. While the front label proudly proclaimed its support for cholesterol and circulation, a closer inspection of the reverse side revealed a startling detail. It contained 1,000 milligrams of niacin per serving. Compounding the risk, he was consuming this twice daily, totaling a colossal 2,000 milligrams of niacin every day, an intake exceeding 60 times the amount typically required by most seniors. Herein lies the danger when niacin is ingested in such formidable doses. It triggers an abrupt and dramatic expansion of your blood vessels, which accounts for the characteristic flushing and sensation of warmth many users experience. However, this initial vasodilation is swiftly followed by a rapid constriction, where those same vessels snap back and narrow. This sudden and violent yo-yo effect on your vascular system can precipitously elevate your blood pressure, place immense strain on your heart, and critically diminish the vital blood flow to your brain. Over an extended period, this relentless expansion and contraction mirrors the repeated tapping of a hammer upon fragile glass. Eventually, something is bound to give way. Tragically, Mr. Miller experienced what is medically termed a transient ischemic attack, TIA, colloquially known as a mini-stroke. For 2 alarming minutes, his speech became slurred before miraculously returning to normal. He initially dismissed it as an isolated incident, a mere fluke. I had the difficult task of conveying the stark reality to him. His daily supplement, which he had conscientiously consumed, believing it benefited his heart, was in fact stealthily jeopardizing his brain. And Mr. Miller's experience is far from unique. Numerous seniors unknowingly consume high-dose niacin. They might opt for flush-free or extended-release formulations, often misled into believing these versions are inherently safer. However, even these modified forms can still elevate blood pressure, provoke atrial fibrillation, an irregular heart rhythm, and adversely affect blood sugar regulation. Here's what you absolutely need to understand. For older adults, any niacin intake exceeding 50 milligrams per day should only be pursued under the direct, vigilant supervision of a medical professional. And if you are managing high blood pressure, grappling with heart rhythm irregularities, or are currently on any prescribed medication, it is critically important to meticulously examine the labels of all your supplements. Fortunately, Mr. Miller has now ceased his niacin intake and is on the path to recovery without suffering any permanent neurological damage. Yet, he shared a profound insight with me that resonates deeply. "Doc, I truly believed I was doing everything correctly. I never conceived I was actually gambling with the health of my brain." Now that we have meticulously examined 5 commonly consumed vitamins, each possessing the covert power to imperceptibly jeopardize the intricate workings of your brain, you might find yourself contemplating a crucial question. What then should I be taking instead? Or perhaps even more pertinently, what foods should I be prioritizing in my diet? Let's shift our focus to the truly efficacious, the profound benefits of real, unadulterated food, the very sustenance that intrinsically safeguards your brain without introducing the latent hazards inherent in some synthetic supplements. By this point, a fundamental question must be echoing in your mind. If these ubiquitous vitamins carry such considerable risks, what viable alternatives exist? This is an excellent, indeed essential inquiry, because the foundational truth remains that your intricate bodily systems were never architected to operate optimally on an array of isolated pills. Rather, they were meticulously designed to flourish and thrive on genuine, whole, natural, and inherently nutrient-rich foods. These are the biological blueprints your brain unequivocally recognizes, efficiently absorbs, and precisely utilizes in perfectly calibrated amounts. Consider the illuminating experience of Mrs. Margaret Wilson, a vibrant 73-year-old retired school principal from Arizona. When I first had the privilege of meeting her, she enthusiastically presented me with a drawer brimming with an astonishing collection of supplements: vitamin D for bone density, vitamin E for heart health, a B complex for surging energy, niacin to regulate cholesterol, a daily multivitamin, and several other concoctions ostensibly formulated for brain support. "I'm doing everything precisely right, doctor," she confidently asserted. Yet despite her diligent regimen, she was persistently plagued by morning dizziness. Her balance felt inexplicably precarious, and her blood pressure continued its inexorable climb. Clearly, something in her elaborate health strategy was profoundly amiss. Consequently, we embarked on a rather radical but ultimately transformative course of action. We systematically cleared the clutter. One by one, we carefully phased out the various pills, replacing them not with other supplements, but with nutrient-dense, whole foods. This wasn't some convoluted magic diet or an esoteric, restrictive program. It was simply about embracing straightforward, wholesome foods, consumed at appropriate times and in sensible combinations. Let's visualize a typical breakfast from Margaret's revitalized routine: a single boiled egg, providing pure, clean protein, half an avocado brimming with essential healthy fats, a modest slice of whole grain toast offering slow, sustained energy release, a generous handful of vibrant blueberries, potent powerhouses of brain-protective antioxidants, and critically, a refreshing glass of room temperature water to ensure optimal cerebral hydration. On occasion, she might incorporate a few walnuts or almonds for added benefit. That was the entirety of it. No intricate powders, no pharmaceutical-grade pills, just real food, recognizable, profoundly nourishing, and deeply restorative. Within a mere few weeks, Margaret reported a palpable difference. Her debilitating dizziness completely subsided. Her previously erratic blood pressure stabilized beautifully. Her energy levels surged anew, and she profoundly stated that her mind felt clearer and more agile than it had in many, many years. The efficacy of this approach stems from a fundamental truth. Your brain desperately craves consistent hydration, an abundance of healthy fats, a steady, unfluctuating supply of fuel, and a rich spectrum of micronutrients presented in their holistic, natural forms. It does not yearn for megadoses, it demands fundamental balance. Some of the most potent brain-fortifying foods for older adults include verdant leafy greens such as spinach and kale, extraordinarily rich in folate and vital antioxidants, fatty fish like wild salmon or sardines, overflowing with omega-3 fatty acids, crucial for safeguarding brain cells, an array of berries packed with polyphenols that dramatically reduce inflammation, diverse nuts and seeds, offering generous quantities of vitamin E, magnesium, and other brain-healthy fats, and whole grains, essential for maintaining stable blood sugar levels and promoting robust cerebral circulation. Remember, these real unprocessed foods don't merely protect your brain, they simultaneously bolster your heart, strengthen your bones, uplift your mood, and enhance your overall mobility. You're not just passively consuming calories. With every conscious bite, you are actively participating in your own healing and rejuvenation. As a final urgent call to awaken, remember this profound truth. Awareness itself is your most formidable medicine. At this significant juncture in your life, be it at 60, 70, 80, or beyond, every health choice you make carries amplified weight and consequence. The ultimate truth is not simply about the pills you may or may not ingest, but rather the depth of understanding you possess about them that genuinely safeguards your well-being. Your body, as it journeys through the decades, fundamentally processes supplements and nutrients in a vastly different manner than it did in its younger years. Even habits that stem from the best intentions, such as routinely taking vitamins, can quietly and unexpectedly backfire if approached without careful consideration and informed vigilance. It is for this precise reason that an awakened awareness stands as your most potent and protective form of medicine. There is no need to live in fear of vitamins, but you are absolutely obliged to approach them with profound respect and intelligent caution. Always read the labels with discerning eyes. Engage in forthright and comprehensive conversations with your trusted doctor or pharmacist, and critically listen intently to the nuanced whispers your own body communicates. If any part of this conversation resonated deeply with you, please consider what change, big or small, you might commit to starting tomorrow. And if you found this information genuinely helpful, a small indication of appreciation from you can make a huge difference in allowing others to discover this crucial content, helping all of us continue to learn, grow, and strengthen our collective well-being together on this journey. You are absolutely not alone, and you are never, ever too old to proactively reclaim mastery over your own health.